Good morning, everyone, and happy Sunday. Yes, I'm wearing pink because it is Breast Cancer Awareness Month, and they do wear pink in honor of that. So we're celebrating all the survivors of breast cancers, those that are going through and fighting and doing well. Our prayers are with you. So God bless. So today, my topic is going to be on, as requested, actually, a member requested this topic on vertigo. And so here we go. I hope this is helpful. Just a short presentation. So what is vertigo? So vertigo is a sensation that the environment around you is spinning in circles. It can make you feel dizzy or off balance. Vertigo, however, is a symptom of lots of health conditions rather than a disease itself. Vertigo is not the same as being lightheaded. People with vertigo, again, you feel as though they're actually just everything is spinning and moving, or that the world in itself is spinning and moving. Sometimes even driving, people may end up feeling this. So what are some of the signs and symptoms? Some people get nausea and vomiting, dizziness, common, balance issues, hearing loss in one or both ears, ringing in the ears, headaches, motion sickness, a feeling of fullness in their ear, and what's called nystagmus, which is a condition that causes your eyes to move from side to side rapidly and uncontrollably. So what are some of the causes? Vertigo causes vary from person to person and may include, I'm just going to go over a few, migraine headaches, certain medications, stroke, arrhythmia, diabetes, head injuries, prolonged bed rest, shingles in or near your ear, and even ear surgery. Some other causes, MS, brain disease, just to name a few, including as well as low blood pressure. So what are the types? So there are two different types. So the two main types of vertigo are peripheral and central. So peripheral vertigo is actually the most common type. It happens when there is an issue with your inner ear or vestibular nerve, and this both help with your sense of balance. It is usually triggered by specific changes in your head's position. This might occur when you tip your head up or down, when you lie down, or when you turn over or sit up in bed. The other type is the central vertigo. This one is less common. It occurs when you have a condition affecting your brain, like an infection, stroke, or traumatic brain injury. People with central vertigo usually have more severe symptoms like severe instability or difficulty walking. So what are some of the possible complications? Vertigo can cause falls, which is one of the most dangerous things. Sometimes people fall, hit their head, and that can lead to other problems, even death. Some people may end up breaking a bone, especially their hip bone, as well as other parts of their body. Vertigo can also interfere with your quality of life and hinder your ability to drive and sometimes go to work, because it's difficult for people to function at times when this happens. So are there treatments? Yes, there are different treatments. So vertigo treatment depends on the underlying cause, however. Your healthcare provider uses a variety of treatments, which may include repositioning maneuvers. There's medications, and the medications are typically used are motion sickness medications, and they're available. You can always speak to your provider to see which one is best for you. Vestibular rehabilitation therapy, which is vertigo exercise. People might say, I've never heard of that. So exercises may include stretching, strengthening, eye movement control, and even marching in place. And then there's surgery. This is rare, but people might need surgery when a serious underlying health issue is the cause of the vertigo. So how do you get vertigo to go away on its own? It's not always possible to get rid of vertigo without the help of a healthcare provider. But here are some things you can try at home to ease some of your symptoms. Move slowly when standing up, turning your head, or performing other triggering movements. Sleep with your head elevated on 2 pillows. Lie in a dark, quiet room to reduce the spinning sensation. Sit down as soon as you feel dizzy, because of course, again, we don't want you to fall. Squat down instead of bending over at the waist when picking something up. Turn on the lights if you get up during the night. Use a cane or walking stick if you feel like you might fall, or just hold on to something or someone. A reminder, if you have severe or frequent episodes of vertigo, it's time to call your healthcare provider. There could be an underlying health condition causing your symptoms. Call your local emergency services or go to the nearest emergency room if you develop vertigo alongside the following: chest pain, heart palpitations, sudden headaches, difficulty walking, a fever over 104.4 degrees Fahrenheit or 38 degrees Celsius, vision changes, weakness in one arm or leg. Don't drive when you have vertigo. Vertigo can come on suddenly without warning. Though vertigo attacks can feel scary, they go away quickly most of the time. If you experience severe or prolonged vertigo, your symptoms could indicate another medical condition. Vertigo can interfere with your quality of life and hinder your ability to do things you want. No matter which type of vertigo you experience, your healthcare provider can help you identify the root cause and determine personalized treatment based on your needs. I want to give special acknowledgement to the Mayo Clinic, the National Institute of Health, and Everyday Health for the information that I provided to you today. I hope this was helpful to the person that asked and for those that may need to know. But should you have any questions, please join me in the Zoom room. I'll be happy to answer those questions for you. God bless you, stay safe, and enjoy the rest of the service.